Many people spend thousands of dollars on back surgeries that often don't work. Medical professionals have been searching for better solutions for decades. But it turns out there's a treatment using acoustic waves that stimulates your body's natural healing process without drugs or surgery. Hi, I'm Dr. Jason Hahn, sports clinical specialist and CEO of HealthFit in Pasadena. In today's video, I'm going to break down how we treat chronic and complex low back pain, from muscle strains and sciatica to disc herniations and facet joint syndrome, using a combination of radial and focused shockwave therapy, enhanced by the latest technology and cellular regeneration, EMTT. If you've been told surgery is your only option, or if you're stuck in a cycle of temporary fixes, keep watching this video. For far too long, people have believed that pain relief only comes from medication or surgery. That if manual therapy and exercise do not work, the next step is an operating table. But what if that's not true? As a clinician who's worked with Olympians, NFL athletes, and parents just trying to lift their kids pain-free, I found that healing is possible when we use the right tools in the right combination. So let's talk about shockwave therapy. Shockwave isn't a massage gun or heat therapy. It's a mechanical wave of energy delivered into your tissues. It's designed to stimulate a biological response. We use two types. Radial shockwave therapy spreads out across a wider area. It's excellent for treating muscle tension, trigger points, and superficial tendons or fascia. Think of it as the wave that opens the gate, increasing circulation and relaxing overactive muscles like the paraspinals, the QL, the glutes, and the piriformis that often compress the sciatic nerve. Next, we have focused shockwave therapy, which penetrates deeper, reaching precise, pinpoint areas like the facet joints, disc, or nerve root attachments. It delivers high energy density that we can manipulate depending on the specific tissue, targeting the root of the problem rather than just the symptoms. These waves create micro-trauma, controlled, purposeful stress at the cellular level. This activates your body's healing response, increasing blood flow, stimulation of stem cells, collagen synthesis, and reduction in chronic inflammation. Now, let's add the secret weapon, EMTT, also known as extracorporeal magnetotransduction therapy. Unlike shockwave, which uses mechanical energy, EMTT uses high-frequency magnetic fields to penetrate deep into the joints, discs, and nerves, up to 20 centimeters. Where shockwave breaks through tension and scar tissue, EMTT goes even deeper, activating cellular metabolism, increasing ATP production, and enhancing the ionic balance inside your cells. This makes EMTT ideal for treating degenerative disc disease, chronic joint inflammation, sciatica stemming from deep-seated nerve irritation, or post-surgical healing delays. What makes this combination powerful is this layered approach. Radial shockwave relaxes and opens the surrounding tissues. Focused shockwave targets the deep structural dysfunction. EMTT boosts healing at the cellular level, long after the treatment ends. One clinical study showed that patients receiving both focused shockwave and EMTT experienced up to 70% faster pain relief compared to traditional methods. Another found that over 80% of patients with chronic disc pain showed meaningful improvements in both pain and function in just 6 weeks. Take one of my recent patients, a CrossFit coach, sidelined by chronic SI joint pain and a disc bulge. We used radial shockwave to reduce muscle guarding around his glutes and his paraspinals, then focused shockwave directly on the L4-L5 disc line, followed by EMTT to enhance mitochondrial activation and reduce inflammation. Within 2 months, he was back to lifting, not just without pain, but with better movement and more control than before the injury. I understand the frustration. When you've tried everything, chiropractic, physical therapy, injections, and nothing sticks, it's easy to feel hopeless. But pain doesn't mean you're broken. It often just means your body needs the right kind of stimulation to reboot the healing process. This isn't about masking symptoms. It's about activating your body's healing system intelligently and non-invasively. Whether you're struggling with sciatica, disc issues, facet syndrome, or chronic low back pain, This combination of radial and focused shockwave and EMTT may be the breakthrough you've been looking for. Here's what you can do next. Schedule a consultation to see if this protocol is right for you. Download our free guide to innovative back pain treatment options, or follow us on Instagram and YouTube for real case studies and tips from our team. Why settle for short-term relief or worse, risky surgery, when the path to healing could be just a few shockwaves away? Hey, if you found this video useful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for our latest tips coming to you every week. Share this video with your family and friends. It might just make their day a little bit better. I'll see you soon.